Marita from the Nurse Lounge, and I wanted to come give you all a clinical update. I have been in clinicals, my own personal clinicals for my DNP program for about 10 weeks now. And so I wanted to share with you some observations that I had and then kind of spin off of that into really what I want to talk about. And that is advancement in nursing. So first, I just want to kind of tell you, I'm in an executive leadership program in terms of my doctoral degree, and I have been going to clinical, like I said, for about 10 weeks now. And what I have noticed that there are no ethnic, or not say no, but there are very few ethnic minorities in these positions. Women are also not really there. So by design or by default, I'm not sure which it is. We are not represented in terms of being women or as well as in terms of being ethnic minorities, no matter which one you pick, in executive leadership positions. And that has to change. So I have been, out of all the meetings I've been to, and mainly that's what I've been doing, in executive leadership with my clinical specifically, I am not doing catheters and things like that. That's basic nursing stuff. What I am doing is following executive leaders throughout their days and seeing what they do, what changes they make, and how it affects students, how it affects patients, and things like that. So every meeting that I've been to has been at the executive level with your presidents, your vice presidents of various boards and organizations and departments, and they come together and collectively talk about things that impact nursing, whether it be nursing students, whether it be patients, whether it be the nurses in the hospital. They talk about this change. Some of your executives are not nurses. So some of your CEOs, or obviously not nurses, but some of your CEOs are not of healthcare background. They are of business or hospitality backgrounds. So with that being said, they know very little about the healthcare arena. So it would be great to actually have someone who is a CEO or a COO who also has a healthcare background, which usually physicians used to usually have that role as CEO of a hospital or something like that. But because we're not finding enough of them, they have now reached out to business people. That's the reason why healthcare has changed to more of a business model, because it's being led and ran by people who have business backgrounds, who do not have a full understanding of how healthcare works, how it trickles down and impacts the nurses, therefore how it trickles down and impacts our patients or our students or whatever it happens to be. So when I say what I'm about to say, because I'm going to get some backlash on this, but I really don't care. This is the reason why. So if you want to know, if you want to be an agent of change, be the agent of change, but you have to kind of move up in your educational endeavors in order to do so. Well, that's not completely true. So I take that back. There are people, the backstory on what I'm about to say is I saw a post on a nursing forum on Facebook, and this nurse was giving her accolades about how she is this, that, and the other. She put all her credentials down. And in some ways, many of the other members of that group felt that she was bashing them or bashing those who chose not to go beyond an associate's or LPN or a BSN degree. And she really wasn't doing that, but her tactic wasn't the best. So that's how it kind of came off. I feel that depending on what side of the table you're on or whatever, there's something to be said on both of those. I feel that we should all advance in somehow, some way. So whether it means you get you a formal degree, whether it means you advance and become leadership in terms of your department, maybe you become in charge nurse or become a nurse manager or something like that, where you were a floor nurse. At some point in time, if you want to have lifelong learning, you have to advance and you have to change. And to be that agent of change, you have to do something. So I want to say, do not complain. Do not complain about what goes on in nursing when the ones who make the decisions are the executive level. You have nothing to say if you're not going to be the agent of change and try to be the voice for your students or for your patients when you are part of the problem. If you don't want to say, hey, there's problems on the floor, How can we create a change and make it impactful for it? It helps the nurses as well as helps the patients. So if you want to sit at the table with the executives, you have to be where they are. So if you're not going to these meetings, if you're not going to these gatherings, if you're not meeting them or going to their offices and simply saying, hey, I am a staff nurse on the OB floor, and this is something we're beginning to see a lot of, and I want to know how can we create or impact change on our floor to better our patient outcomes. Then if you're not going to say that, then you're not being a leader. So being a leader doesn't mean you have to be formally educated to be so. It doesn't mean you have to have a doctoral degree, as I'm going to get. But it does mean that you have to have a backbone and a spine to say there are problems where we are. How can we create that change? So that's kind of how I feel about that. I'm pro education, as you see. I would not be pursuing a doctoral degree if I was not pro education, but I do understand that this is not for everyone. Everyone does not want to go back and pursue a master's or doctoral or even a BSN degree. They don't see a point of it at this point in their life, and that's perfectly okay. However, I will say this: when it came to that post, do not bash someone who chooses to carry on their education, to go forward, because they are forward thinking and they want to have obtained higher education because they want more options. That's what that does for you. You can make 6 figures without having a degree at all, to be honest with you. But if you want to have more options, you have to get more education when it comes to nursing specifically, unless you know someone. Now, if you know someone, so be it. But the education is what gives you that proper training so that you can know what kind of questions to ask, so you can know how it's going to impact your patient population or student population. So as I was saying at the very beginning, there are not very many minorities and or women in executive leadership positions. That means they're the top of the top. They're the ones who make decisions for you about how much you get paid. They make the decisions on you about how many patients that you have. They make the decisions for you about which acuity is. They make the decisions about when you can work and when you can't work. They make decisions about when you get paid for time and a half on holidays and which holidays you get paid for and not get paid for. They make decisions about when you clock in and clock out. They make those type of decisions. And if you want to create the kind of change that you want, you have to sit at the table with these people. I'm in a position where well, no, I'm not in a position. I'm going to school to be in a position to sit at the table with some of these individuals so that we can create that change for us nurses. Someone has to do it. And so I'm saying whatever level you are in, whether you are an LPN and you see there's changes that need to be made on your unit in your LTC facility, you need to be the one to be that reason, that voice of change. Do not think you have to be in executive leadership position in order to do so. If you want to be a ADN, all I'm going to say about the ADN is I'm not bashing them at all. Keep on doing what you want to do. Do whatever you want to do. But to know to have options, especially in the acute care setting, as these facilities go on to magnet status, you will have to have a BSN in order to work in these facilities. Now, you will have a job. I'm not saying you won't have a job. You will always have a job. But sometimes it's not about the dollar amount, it's about the opportunities that you have. So be mindful of that. Everything is not about money. And if you're working in nursing for money in the first place, you're in the wrong job for that. You can make good money, but you best to believe you're going to work for that money. So can an ADN and the BSN make the same amount of money? Absolutely. Actually depends on where you work in the state you live in, the city you live in, and the just salaries in general. Yes, you can. I'm not telling anybody to, that you should go on. I'm telling you to do what's best for you, but whatever level you choose to be at, make sure that you are being a leader in that position. Make sure you're being an agent of change in that position. You do not have to be an executive leader to make changes. However, like I said, you need to be able to slide those credentials across the table when something needs to be said or done for your students or for your patient population. Do not complain about something when you have not did anything about it. Do not complain about something when you have not voiced your concerns. It's the same thing about voting. Don't complain about who the president is if you didn't vote. You have no right to complain. Same thing in this situation. If you want to see change, become part of your unit practice council. That's a form of leadership, and you can do that as a LPN, as a 2-year or 4-year RN. Be a part of your unit practice council so you can kind of create change, at least for your unit. And then maybe depending on the changes that you make, you can carry that forward, and they can carry that out hospital wide if that's what they want to do. When it comes to academia, which is what my world is, I'm trying to go into academia versus the clinical side, and I still work in the clinical side. My goal is, for now, is to represent ethnic minorities and women, and in the faculty standpoint. How many of you who go to nursing school can count on even one hand 5 African American, or no, not African American, ethnic minority faculty at your institution? 5. Now, if you're going to a HBCU, that may be different, but for the rest of us who go to PWIs, predominantly white institutions, is what that means. How many faculty in nursing can you say you have or have seen who look like you, whatever you happen to look like? So if you happen to be of African descent, how many look like you? How many people look like you who are Hispanic? You rarely see them. How many people look like you who are male? Males are not ethnic minorities, but they are minorities in nursing. So how many male faculty do you see? You'll see more male faculty before you see ethnic minority faculty, depending on the school that you go to. Again, take HBCUs out of the equation because we know that they are they heavily employ ethnic minorities. Hence it being an HBCU. They actually employ other culture, other races as well, but just know I'm not talking about them. I'm talking about all the other institutions. So we're not well represented. So therefore, that's why I'm here. I'm here because of the fact that we need to have nurses who are women, which you're going to find women in faculty anyway, but who are also ethnic minority, so they can represent the students, so that the students can represent the diverse populations that they actually serve. America is a melting pot. We have everything here. So why is it that our faculty don't look like that? Why is it that nursing doesn't look like that? Think about that. Why is it that nursing doesn't look like that? African American nurses only encompass about less than 10% of the U.S. population of nurses. We're talking about 4-year RNs, 2-year RNs, LPNs, master prepared, doctoral prepared. Fundamentally, we're all nurses. So we represent 10%, or a little less than about 9.6 or so percent of the U.S. population in nurses, and we have 4 million, roughly 4 million nurses in the United States. So if we represent 10% of that, that's not a lot at all. And someone actually mentioned in one of my videos, she being, I think, either Mexican, she said, I think she was Mexican. She said that they are the true ethnic minority. And I'm like, you know what? You're absolutely right. You are absolutely right. So they definitely catch it. So again, I want to be able to slide those credentials across the table to say, you know what? Not only am I African American, not only a woman, but I'm also educated, and I can be in this role with these men. So in case you didn't know, in executive leadership positions, men, white men, Caucasian men, are the holders of those executive leadership positions. They are making the decisions for you. These white men have never had a baby. So how are they to say what works on my OB floor? From a business model, they say things that don't work, that they think would work. But they don't think realistically about how tired my moms are when they've just pushed out this, or been cut open, however you want to look at it, this however many pound, 8-pound baby, 5-pound baby, twins. They don't think about that. But they think about their outcomes in terms of how they can generate more money because they are business minded. They want us to do bedside report because it's better for patient outcomes. They want us to do hourly rounding during the day because it's better for patient outcomes. But they don't factor in the patients that our patients are relatively well. And we do this and then we get cursed out because of the fact that, they don't want us to do hourly rounding. So these are some things to keep in mind. I'm not here to bash anyone who does not want to move forward in their education. I am not here to bash anyone who wants to stay where they are. I think nurses are needed everywhere. So if you're about to retire in 2 years and you don't want to go on to get a degree, I get it. If you don't have the money, the time, I get it. But in no way do you have a right to talk about the people who do want to go on to get their education. Like, I don't, I catch it all the time. People's like, I can't believe that you have a master's degree and you still work in a hospital. Well, I don't know who you think is going to educate these students about how to be a nurse who does not practice nursing. Would you really want someone taking care of you or teaching the next nursing student who does not currently practice his or herself? And that's exactly where I am. I currently practice not because I have to work in the hospital. I do it for the sake of the student who's going to care for the people who they're going to care for. And what can I possibly teach a student if I don't do it myself? That's why I still work in a hospital, for the people who really want to know why I still work in the hospital. I work PRN, so I don't work, 3 days a week or anything like that, but I work enough where that my experience is current and I'm not teaching students something based off of what happened 20 years ago, or in my case, 15 years ago when I first became a nurse, because that stuff is obsolete, out of date, is done. So again, we have to grow somehow, some way. We're either going to grow by getting more education. We're going to, in terms of formal education, we're going to grow by going to seminars. We're going to grow by going to conferences, going to in-services, doing your CEUs or continuing education units, if whatever your state requires. That's how we're going to grow and learn. So it does not have to be formal education. It can be just where you are just studying yourself. Certifications, I forgot about that. Certifications are another way to continue to grow and learn about your specialty area. So again, I impress upon you to be an agent of change. I impress upon you to be that nurse who is going to be a lifelong learner, to be that nurse who's going to be an advocate for your patient and stand up for what's right for your patient. And at the end of the day, you have to protect your license. That's why you got it. You have a license to protect it so that you can make sure that you are definitely doing the best thing you can for yourself and for your patient. I just want you to know that, this started out being about my clinical, which I know, and clinicals are going well. And I'm going to campus, as you all know, the ones who have followed my doctoral journey since I started on YouTube. I have a hybrid program, so I'm going to campus next week, and I will vlog while I'm there to tell you what's going on. I will be taking my cap and gown pictures, but anyway, that's something, I digress. That has nothing to do with this video. But anyway, I will be vlogging that. But my whole point again in this video is, if you want to create change, you got to be able to have a seat at the table. And the table that you sitting at, they're not discussing the same things that you think they're talking about. So if you want to create that change, be an agent of change wherever you are. Whatever level you are, there's no excuses. You have to be an agent of change. If you want nursing to get better, if you want people to come in who are qualified to take care of you, who's not going to kill you, you have to be the agent of change. If four weeks of orientation is not enough for a new grad, which it rarely is, it never is, then you have to speak up and say something. If you are sick of your ratios, then you need to say something to the CEO or the CNO, Chief Nursing Officer. If you want them to know what goes on your floor, invite them to come down and shadow you so they can see what goes on your floor, so they can understand why you're asking for another nurse, for another employee, for some techs, for some help. You have to be the agent of change. And if you're not going to be the agent of change, why are you here? Point blank, period. Why are you here? So just be mindful of that. I just wanted to kind of share that with you. Again, my observations that I've had since I've started my clinical rotations. I'm thoroughly enjoying clinical, to be honest with you. I'm enjoying sitting at the table with the execs, hearing the dialogue, hearing the conversations. And again, that's what prompted this video, because they're making changes for you, and they're making changes about things that they have. You have no idea that it's going to impact you. And at the end of the day, they're going home, going to bed, and you're going to have to deal with the consequences of whatever happens, because that's just how it works at that level. You want to be the agent of change. So anyway, that's all for this video. If you want to know more about my doctoral journey, there's other videos. I'll be posting more. I'm about to post a video on a question that a subscriber had for me regarding, what was her question? It's basically, she is a nurse from one specialty area moving into OB, and she wanted to know specifically what tips that I have for that. I'm gonna have that video linked to this one. So you may see it before this one or after this one. I'm not sure when I'm posting it. It'll be posted, relatively close together. But that's pretty much it. So if you want to follow me on IG, you can follow me. The banner's at the top, the link's up there. Subscribe. However this goes, subscribe, comment, share, all that stuff. So anyway, until the next time, y'all take care. Bye bye.